Hello guys, welcome back to my channel. If you're new here, thank you so much for dropping by. For stopping by, please just go ahead and click the subscribe button. And to my returning subscribers, thank you so much for your love and support, most especially to those that watch my videos to the end. I really appreciate you. I love you. So please just go ahead and like this video, like it before we start. So today I'll be talking about 6 effective birth control methods, and I'll be going straight into the video right now, so stay tuned. I said I'll be talking about 6 effective birth control methods that can help you prevent pregnancy. If you've not seen my other video, my previous video, please just go over there and watch it. I talked about discussing family planning methods with your doctor at your 6th-week appointment after having a baby. So that's very important. You need to do that. I know a lot of people are confused on what do I choose, what do I do about family planning. So I'm going to be digging deep into it today. There are questions you need to ask yourself before choosing a birth control method. Firstly, you have to ask yourself, what are my family goals? When do you want to have children? Do you want to have children in the next 5 years, 10 years, 2 years? You need to know exactly when you want to have children. And the next thing you need to find out, you need to know your health status and your medical history at that particular point. All this you need to discuss with your gynecologist at the hospital at your 6th-week appointment, or whenever you need to do a birth control method. You need to discuss this thing so it can help you choose the right family planning method for you. I'm picking just 6 family planning methods, and all of them are reversible. I'm not talking about anything permanent or reversible methods. So I'll be going straight to number 1, and my number 1 on the list is the non-hormonal IUD. The non-hormonal IUD is the copper IUD. It's a T-shaped. I'll be putting it on the screen here so you can see how it looks like. This device is coated with copper, and it is fixed into the uterus at your 6th-week appointment, or whenever you go to the hospital to get it in. Sperm and copper, they don't go the same way. They kill them, and the sperm does not like copper. So this is highly effective. It is 99.9% effective and reversible. So immediately you take it out, by your next cycle you can fall pregnant. Now, to get this in, as I said before, you need to go to the hospital, and it needs to be inserted by a qualified health professional. You need to make sure you're doing it at the hospital. And insertion of this IUD can be painful for some people, while some other people, they don't feel so much pain. As for me personally, I felt pain getting this IUD in. So I'll advise to prepare yourself for going for this procedure. You can take a painkiller to prepare yourself, and afterwards you take a painkiller. And after insertion, you may spot for a few weeks, and then the spotting stops and everything becomes normal. But the side effects of this copper IUD is heavier flows and cramps. If you're someone that already has heavy flows and cramps, I will advise you to think twice before choosing the copper IUD. But apart from that, it is okay. It's long acting. It can stay for like 10 years. So if you think about that, I think it's a good option for preventing pregnancy for those that don't want to have children for a very long time. And this same copper IUD, some people have complained of recurrent infections with having the IUD placed in. So all these methods, they have their pros, they have their cons. So you just need to know the one that works for you. So that is it for the copper IUD. So my next on the list is the number 2, the hormonal IUD. And before I forget, I think I didn't define what IUD means. IUD means intrauterine device, a device put into the uterus. So I'll go back to my number 2 again, the hormonal IUD. This IUD contains hormones which are released little by little to prevent pregnancy. The hormone is actually progesterone. It is coated on the it looks like the copper IUD, but the difference is that this one has hormones released from it. And the hormones, the good thing about this is the hormones are concentrated in the uterus. It doesn't come out to other parts of the body, thereby reducing side effects from the hormones circulating your body. So I think it's a good one. It works for as long as 5 years. It is 99.9% effective as the copper IUD. So the good thing about this one is that some people like about this one is that once you place it in, after a while, you may not have periods. So if you're someone that likes not to have periods, this is a good option for you. And the insertion may be as painful as the copper IUD. It just depends on you preparing yourself beforehand. Like I said before, some people may not feel pains, but some people will definitely feel pains. So after insertion, you may spot for a while, 2-3 months, but with time, as your body adjusts to it, you will not spot anymore, and your periods may even go away. That is it for the hormonal IUD. The third on the list I'll be talking about is the birth control implant. I'll be putting it on the screen here. It's just a small rod like a matchstick placed underneath the skin of your upper hand. So this procedure of putting it in is at the hospital too. Your doctor will give you a local anesthetic, at least to help ease the pain. So the issue with this, some people complain of soreness after insertion, but after a while everything is fine with it. You may not feel so much soreness and pain anymore around that area. Very effective, very effective. But the thing is that it contains hormones. This rod placed in your arm, it contains hormones, and some people come down with side effects, continuous bleeding, continuous spotting. I know some ladies that have used these implants and they have spotted for a very long time, even up to a year. You can be spotting. Why there are some people that don't even have periods. The thing with this birth control is you don't know the one that would suit you until you try them. That is it for the implant. I think I've heard its popular name is the Implanon. As you take it out, go to the hospital and you take it out, I don't want again, your fertility returns ASAP. You can get pregnant by your next cycle. Although there are some side effects from headaches to dizziness and all that, but the one that people mostly complain about is weight gain. This Implanon makes you gain a lot of weight, but if you can watch your diet and keep exercising, you can control the amount of weight you gain from being on Implanon. The next one I'll be talking about is the birth control shots. This is an injection that is given to you at the hospital every 3 months. It is very effective in preventing pregnancy, and it is reversible. If you are sticking with this birth control method, that means you have to take it like 4 injections in a year. That is every 3 months, and once you take it as you're supposed to take, you would be able to effectively prevent pregnancy without issues. I think a name I know that is the common name for that injection is provera. So the side effect of this injection given to you is that your fertility does not return immediately. In fact, you have to wait for it to wear off. And if you're having side effects with this particular birth control method, you have to wait the 3 months for it to wear off, and your fertility will not even return till at least 12 months or less after you stop using this particular birth control method. So if you know you are going for this, when you stop using it, don't expect sharp you're going to get pregnant. It may not happen that way. It takes time for your fertility to return. Another complaint people have about it is that they complain of headaches, breast tenderness, and massive weight gain. So if you don't want to gain so much weight, as I said before, you need to eat right and do a lot of exercising to prevent excessive weight gain. And another thing is that once you put it in, just like the implant and the IUDs, you don't need to bother yourself about it, and you're just good to go, safe from being pregnant. Those are the good things about this particular birth control methods I've talked about so far. So that is it for the birth control shots. So the next one on the list I'll be talking about is the birth control pills. The birth control pills are widely known and widely used. There's the combination birth control pills, and there's the one that is just the progestin only. So this combination birth control pills, the combination one contains estrogen and progesterone. So I'll advise for ladies, for women that are breastfeeding, you shouldn't go for the estrogen and progesterone, because this can affect your estrogen, can affect your suppress your breast milk production. So if you are planning to breastfeed, it is not a safe option for you. And the thing about this birth control method is that you have to take these medications every day at the same time. As simple as missing a day or missing the timing can reduce its effectiveness. So you need to be very meticulous in using the birth control pills. And also, those that have certain health conditions are not advised to use this particular birth control methods. That's the pills. And the birth control pills too, they have some added advantages of preventing osteoporosis, treating acne, hormonal acne. They have advantages, and at the same time they can even lighten your period, reduce your cramps. They are good at doing that, but at the same time they have some negative side effects that can affect your health if you haven't discussed with your health professional before starting them. So the combination ones too, if you have migraine headaches, I would advise you should not use it, because the estrogen there can increase the intensity of your migraine headaches. Then the progestin only can be a good option for those that want to take pills and are breastfeeding. It's a good option for you, and it needs to be taken every day at the same time. And another thing I forgot to mention about the birth control pills, other medications can affect the effectiveness of the birth control pills. So, and a good thing of the birth control pills is that you can choose not to have a period, you can choose when to have a period. So the birth control pills have their own advantages and have their disadvantages. The next one, I think that is the sixth one, the last and not but the least, is the barrier method, the use of condoms. Now, if you're someone that doesn't want to put anything into their body and you just want to use something you take in and take out, the condoms are the perfect choice for you. These condoms, the male condoms, are more effective in preventing pregnancy than the female condoms. Now, out of all the birth control methods I've mentioned, the condoms are the only birth control method that prevents sexually transmitted infections if used properly. Reusing the condoms will reduce its effectiveness. Using them wrongly will reduce its effectiveness. So using an expired condom will affect its effectiveness. So you need to use a condom that is latex condom that is not expired, that is used correctly, and you will have a very good chance of preventing pregnancy. Another thing with the condoms is the day you forget to use the condoms and you are ovulating, you will fall pregnant ASAP. It will just happen. So every single birth control method have their pros and their cons. Okay, so I think the best decision I will tell you to take is to discuss with your healthcare provider, and I think you should discuss with your mom. What family planning method did you use? If the ones that worked for her may surely work for you. So this is me just telling you 6 effective birth control methods that I know works. There are other birth control methods, the use of rings, the diaphragm, the spermicide, but I just chose to discuss these 6 ones because I know how highly effective they are in preventing pregnancy. So if you have any questions for me, please just go in to the comment section and ask your questions. You can go to my DM on Instagram and ask questions. So if you know you enjoyed this video, please just go ahead and click the subscribe button and like this video and share it to your friends that just had a baby or have a hard time choosing a birth control method. Thank you for watching. I'll see you in my next one, and bye.